welcome to Fertility Talks. I'm your host, Mary Wong. This is live post number 102, and I'm thrilled to be here live in Montreal with my team member from Alive Holistic Health Clinic, our resident, one of our residents, naturopathic doctors, Dr. Zeynep Uraz. So welcome.
Thanks for having me.
And it's really great. We're totally doing an ad-lib thing. We're sitting here in my hotel room.
On your bed.
On my bed. Nothing else is going on here. But it's actually quite appropriate because we're going to talk about sex, hot tubs, and hair dyes and the impact or no impact on fertility and pregnancy.
Right. So we're here at the Canadian Fertility and Andrology Society Conference. It's the first day, and we just wanted to bring to you some updates from one of the talks.
So yes, and we just, one of the doctors who was an OB who kind of kicked it all off, his name was Dr. Cleve Ziegler, so I hope you get to watch this. Loved your talk, and because you cover a lot of things that women all ask every single day in our practice, right? Don't you get it all the time?
Totally. And these are questions that come up during pregnancy, but some of them also relate to preconception as well. So it's questions that we get from a lot of our patients who are trying to conceive.
Absolutely, and like every day. So let's make it real, and let's discuss the very first thing. Oh, actually, you know what? Before I go on, I just want to say that and share with you all that I had the privilege of actually speaking at the Canadian Fertility Andrology Society for the nurses, and what was so cool was that there were over 100 nurses across Canada attending my talk, and what was even more cool was that when I asked them how many people had done acupuncture, guess what, guys? More than 90%, I'd say like 95% in the audience have done acupuncture. So isn't that cool?
Yeah, that's really surprising to me. I thought the number would be like maybe 20 or 30%.
I know, exactly. And in fact, I thought maybe there would be like 20 people attending. So thankfully, there were over 100 people attending, and they were interested because what I had to say was, you know, patient-centered care, how can we level up on the level of care by your fertility doctors or by your fertility clinics? And so they were there, and they were enthusiastic, and they were also very receptive to the fact about, you know, perhaps collaborating and aligning with complementary services. So that's really great.
Yeah.
Okay, so I know you guys are anxious to find out about what Dr. Ziegler, who actually I think he did his medical degree or something at U of T.
Did you mention the title of the talk?
Oh yeah, what grabbed our attention was his talk's title was called "Will Papaya Put Me into Labor and Other Questions About Lifestyle and Pregnancy?" So there wasn't that much to say about papaya.
That's true. Although surprisingly, he did mention that in some cultures the word papaya comes from the words harming infant. So there's a lot of like cultural lore around avoiding papaya during pregnancy, and apparently unripe papayas are potentially unsafe, which I was unaware of. Personally, I don't really like papayas.
Yeah,
not my favorite.
But who the heck would eat unripe papayas
True.
Anyway? Like, if I'm going to eat it, it has to be ripe.
Yeah.
Like,
Yeah.
really. So, really, anybody that likes papaya, no worries. Just eat it ripe, okay? So that's number one.
Yeah.
So next is, well, let's start with hair dyes.
Let's start with hair dyes, yeah. So what's interesting is any of the research that's been done with hair dye and pregnancy is with the occupational use of hair dye. So people who are hairstylists applying hair dye. What I thought was so interesting, because this man works in Montreal as an OB, and he said that here in Montreal, as a standard practice, anyone who's a hairstylist automatically gets leave from work, medical leave from work.
Which is so cool. Like, as soon as they find out they're pregnant, they go off work because potentially they're going to be more exposed to chemicals than someone who's just getting it done, right?
Right. But the bottom line is, hair dye really, if you're just getting your hair dyed one time, first of all, there's the carcinogens in hair dye were removed a long time ago. And if you're just getting your hair dyed, then, it's very safe to do it. If you want to be extra careful, you can avoid getting your hair dyed in your first trimester of your pregnancy. If you're trying to conceive, also it's likely very, very safe to get your hair dyed.
Yeah, so really there's like little carcinogens in it. So maybe the only really bad thing, I have to dismiss alarm. As long as you don't eat
joining
it.
us. Hi, Lily.
Hi, Lily. As long as you don't eat your hair dye, I think you're good to go.
Nothing much gets absorbed through the skin.
Yeah. Okay. So next
was one of the topics was hot tubs. So can you go into a hot tub when pregnant or trying to conceive? Really, there is an actual legitimate concern around certain birth defects when your body temperature is raised during early pregnancy. So really, I mean, there's a lot of information about how long you need to be in a hot tub and how hot it needs to be to actually raise your temperature by about 1 to 1.5 degrees, which is the point at which it becomes unsafe.
Yeah.
However, it's probably safe to have a warm bath.
Well, showers. Okay, so this is a good question, because what I hear sometimes from patients, they get so freaked out that when they take a shower, they take a cool shower. I'm like,
right.
Who the hell likes that?
No.
Right? That's more harmful.
Yeah.
So the point is, it's okay to take a hot shower, and as long as you're not taking it for an hour and raising your core body temperature a degree or two, then you're totally good to go, whether you're trying to conceive or where you're actually pregnant, early pregnancy, first trimester.
But probably a general rule of good thumb is to avoid hot showers. We have a question from a viewer about hot yoga, and that's actually an excellent question. I don't know about you, Mary, I probably get the question about hot yoga more often than hot tubs and hot showers.
Yes.
Generally speaking, unless like hot yoga is everything you do, I tell individuals to avoid doing hot yoga, especially men, obviously, but women as well.
Well, wait. Let's back off. It's not so obvious. Some viewers might not know.
Right.
So why are men not... I covered this in my book, Pathways to Pregnancy, but speak to that.
Right, so the sperm are especially sensitive to temperature changes. That's why the testicles hang away from the body to allow... And the process of spermatogenesis actually creates heat that needs to be released as well. So sperm production is very sensitive to temperature, but, there's not really the same evidence to support avoiding it for women. But, we have a conversation with each individual patient and talk about how important is hot yoga to you. Can you do regular yoga for a little while?
Exactly.
I think it's probably prudent to avoid hot yoga while trying to conceive, and definitely during pregnancy.
Okay, so I have a question for you.
Okay.
Have you ever done hot yoga?
I have.
And? Don't you sweat like
love
crazy?
It.
Okay,
Yeah, it's
so
great.
I hate it. But some people do love it. And here's what I see: when you sweat like a total crazy person.
Kneecaps are sweating. Places that don't sweat, which is why I love it.
Okay, so here's the thing: if you're trying to create a lovely embryo, or when you're trying to conceive life, is like sweating excessively like that. Is that really good for the person? I don't know.
I mean, who knows for sure? Right, sweating excessively in general. I found with hot yoga, personally, it takes a lot to rehydrate after that.
Yes.
So just being very careful around making sure you're rehydrating, not just with water, but maybe some light electrolytes as well.
Yes. Oh, and I love this. Dr. David Bray is here. Also, the risk of infections, especially respiratory, if the studio does not have good ventilation and acts as a giant petri dish.
Yeah.
Risky for all. And you know what, really, David, that is the number one reason why I never went back, because I actually felt gross in it.
Yeah,
I'm like,
seriously.
ew, how often do they really clean? And how is this totally creating lots of bacteria around me? Right? So I didn't quite like the smell.
You don't like the smell of 35 people sweating in one room?
So logistically, it just didn't do well for me.
Right.
But, and I do know that some of you out there do love the hot yoga. And so if you're not actively trying to get pregnant, maybe it's okay. But, definitely not once you found out you're pregnant. I totally would steer
avoid
clear.
Yeah.
Right?
Yeah.
Okay. Did we cover that enough?
Yeah, slimy yoga mats. Yeah,
Slimy yoga mats. Yes, and you slip off the mats. It's gross. Sorry. I'm sorry for those hot yoga lovers. I'm sorry.
All right.
Okay, next.
Okay.
I love doing this in tandem. We should do it more often. Okay.
Noise. I thought noise was a really interesting one. I don't actually get that question very often at all, but the question around, like, is it safe to go to a concert, especially when you're pregnant, not so much obviously when you're trying to conceive. Can it be harmful to the growing baby? And the answer was basically any noise that's louder than a chainsaw is potentially harmful to the baby. So what did he say exactly? He said maybe like heavy metal concerts avoid,
Yes.
but
He's like, but a jazz concert is okay.
Yeah. So that's interesting. And that's something new that I learned today, that, you know, considering avoiding really loud music or noises, something I hadn't really thought about.
Well, you know, I don't know if I should share this, but okay, I will. I had a lady who did a frozen embryo transfer, and when it didn't work, she blamed it on this movie that she watched, which was like really loud, and she thought for sure that was why she didn't conceive. So really, for me, is if there's any shadow of a doubt, and if you're risk adverse, just don't do it, right? Do with what you're comfortable with.
Totally. Listen to what you feel, what feels right for you.
Okay, but, you know, and in that case, did I really think that that caused anything? I don't think so. But, you know, obviously she wasn't comfortable with that. So don't do what you don't feel comfortable with.
So the next one was around sex. Sex during pregnancy can induce labor. And in fact, although there's a lot of, again, like cultural lore around the idea that having sex can induce labor, I think there was a systematic review that showed that in fact it doesn't.
It doesn't, yeah. And so and if we talk about actual fertility, so a lot of women are fearful of having sex just after transfer or after an IUI or just, you know, post trying to conceive even naturally sometimes, right? And here's the other piece. Sometimes the men are scared off to have sex. So you kind of don't even have to make a decision. Because they're fearful, oh gosh, like especially if you've already had a miscarriage, you're like, oh,
Right.
I don't want to touch you with a 10-foot pole.
Yeah, and I think in early pregnancy, especially if there's a risk of miscarriage, then we're talking a bit of a different ball game and something to consider avoiding for a period of time. But if you're talking about like labor induction in your third trimester, it doesn't really seem to be, unless there's like a health condition or there's an issue, then that's a different conversation to have with your individual healthcare provider.
So I think that's that. Well, you know, how I didn't check out what the time is, but maybe we could just add one more in because I like sushi. I don't know about you guys. And a lot of North Americans, especially with the advent of more gluten-free products,
Right.
like people are steering away from more carbs and they're going towards something like sushi. And now, just so you know, in fact, when I was going through acupuncture school, Chinese medicine college, I worked at a sushi restaurant. So
I didn't know that.
Yeah, so the worry about sushi raw fish are threefold. Do you remember?
Right, yes. The first one is risk of parasitic infection. The second thing is like something to consider with sushi, not so much a risk, is the beneficial fatty acids.
Yes.
And then the third one is the mercury toxicity.
Yeah, and really the biggest piece is the mercury toxicity. That one is very real. But when it comes to any kind of threat of parasitic infections, I've been there, I know. I'm like, oh, wow. I learned that sushi is actually very safe done with the right sushi chef. Because so when I was out west, this is what they caught the fish, the salmon, for example. They would catch it on the boat that day and they bring it, but what they do is they don't automatically, so what we imagine is that, you know, they take a slab of meat and they automatically chop them up and then give it to you. But what he did was you have to stick it in the freezer, and his protocol was he has to stick it in for 72 hours. Now this physician said that it's flash freezing. And so he didn't actually give a specific time frame, but I know as a fact in the sushi restaurant, they do it for sure for 72 hours. And obviously if it stays longer than that, it's fine. It's just freezing it, right? And then they thaw it back out. So when you see fresh sushi, it's actually not as fresh as you think.
Right. Which makes sense because it always tastes so fresh, but we live in Toronto, so it obviously can't be like, right off the boat kind of thing.
Yeah, they freeze it immediately and then you take it.
Yeah. So a big concern with sushi is the type of fish that we eat in sushi, and one of the biggest sources of mercury toxicity or high levels of mercury is albacore tuna, and that's a very common fish in sushi. So in fact, and I thought the story he mentioned was interesting. Is it his clinical receptionist, I think? She eats a lot of sushi,
like every day.
Or was it a patient? I can't remember. But to the point where her mercury levels were so high that she had to stop eating sushi so regularly.
Yeah, I had a patient like that, in fact. Her mercury levels were through the roof. She wasn't getting pregnant when she, and I don't know how it came up that we tested, well, I didn't test it, but she got it tested and it was through the roof. And her lifestyle was that she was eating sushi like 5 times a week.
And mercury is not a standard test that we do in the fertility community, but it is a test that your doctor can run, your naturopath can run, and if you do have suspicions that it might be high, it's worth testing. There is one small sample that was observational, one small study that was observational in an Asian population. I can't remember exactly which country it was done in, where there was an association between high levels of mercury and fertility rates.
Yes.
So it's worthwhile, if only just for the risk to the future baby.
Yeah, absolutely. Okay, so there was more stuff, but I don't want to keep going on about it. And so if Dr. Ziegler is watching, I would love to interview you sometime. That'd be fun. He's quite the character, by the way.
True.
So that's it. And we have many more days left. So I'm excited to, see more and report back. So have yourself a great week. And we shall see you next week. And I don't remember who I'm seeing next week, but, I'm seeing someone awesome.
Yeah.
Don't look at you. Okay, wait, what is this? Oceanswatch.org has a list of relative safety of different types of fish in different areas. Awesome. Thank you, David, for that contribution. And thank you for acknowledging our talk. And thanks for tuning in. We shall see you next week. Okay, take care.
Okay,
Mwah.
bye.
Oh.